All right, we're all good, Kerry.
All right, thank you for joining us this afternoon. My name's Kerry Doolan, and I'm joined by colleagues from APNA. APNA is collaborating with the Australian Digital Health Agency to bring you Nurse Digest, a monthly series of bite-sized education sessions with a nominated topic and interactive Q&A session. We'd like to acknowledge the traditional custodians upon the lands which we meet right across Australia, to pay respects to elders past, present and emerging. Myself, I'm joining you from Awabakal country in the Hunter region of New South Wales. So this afternoon, we're going to discuss updating My Health Record and My Health Record across the board, and is the information that we're viewing up to date and current, and what elements contribute to that. So we'll discuss My Health Record documents and how they get there. Data quality, so bearing in mind that My Health Record is an example of sharing information from your practice to future providers that the patient might see. And resources, what a few resources that support you with all of this. And we're keen to hear feedback, hear about your experience using My Health Record, what works, what doesn't work, your experience with data quality. And we're keen to take any questions, comments, thoughts, feedback. So basically with the documents, I mean, we'll firstly start with the overall picture. There's over 22 million Australians that have a My Health Record, which equates to a little over about 9 out of 10 of your patients will have a My Health Record. You might remember in 2018, there was a large campaign to make the Australian community, both providers and consumers, aware that they had the opportunity to have a My Health Record, but if they didn't want to have a My Health Record, they could opt out. So generally, we've seen only about just around the 9% mark opt out. So in effect, that 9% will not have any information of course, available in the My Health Record. There are many documents in the My Health Record. Some of those are automated, and we'll describe a bit about what that looks like. But not all documents are in the My Health Record. So we'll talk a bit about what we can expect there. There's 99% of community pharmacies now registered to the My Health Record, which is a remarkable statistic. And about 85% are using My Health Record. Around 94% of general practices are registered, and remarkably about 84% are using. So we've got huge strides forward. The number of those sectors not using is in the minority. I guess the health sectors that are using My Health Record the least currently are allied health, aged care, and we've got a real focus on specialists at the moment, but specialists are another area that there's not a huge amount of use. But many other sectors such as these and public hospitals are utilising My Health Record. Interestingly, you will hear, if you haven't already, some doctors sometimes talk about the fact that they're concerned that patients might hide information. They might have a My Health Record, but they might adjust it with their access controls. And it's interesting to note that only 38,000 records actually have advanced controls of access applied to their My Health Record, only 38,000 out of the 22+ million. So this is a list of all the documents you might view in a My Health Record. Some of them get into the My Health Record automatically, and some of them get up there through a manual process. So where there's a manual process of upload, we see a lot less of those documents than where there's an auto upload opportunity, and then we see a lot more of those documents. So with the auto uploads, we see particularly with Medicare information makes for very much the basis for a brand new for a basic My Health Record. As soon as there's contact with the Medicare database, that includes Medicare billing history, pharmaceutical benefit scheme history, so medicines history, as well as the Australian Immunisations Register. They're automatically populating into the Medicare overview of the My Health record. Public hospitals and private hospitals, when they're set up for My Health record, and public hospitals being right across Australia, all public hospitals, many public hospitals are uploading. In some states like New South Wales, Queensland, all hospitals are uploading discharge summaries, but not all discharge summaries. Most discharge summaries are going up to My Health record, and that takes place automatically. Pathology reports, so inpatient public pathology reports, public sector inpatient pathology reports are automatically uploading throughout Australia, as is diagnostic imaging reports are automatically uploading from public providers in Australia. Private pathology, we've got a real focus on private pathology going up to My Health record. That requires a general practice to call their pathology provider, their lab, and ask for pathology to go up to My Health record, and ask how do I check that that's going up, particularly for those using Sonic providers and Australian clinic labs. So there's a sense of needing to make a manual process to phone up some labs and request that private pathology goes up, and so that has to take place before there on in pathology can automatically go up to My Health record. Prescription records, you can have part of the eHealth PIP, the practice incentive payment package, is that prescription records should be going up to My Health record via ERX or Medisecure being installed. So there's the capability for prescription records to go up, and that is an eHealth PIP requirement. Given that we've got so many pharmacists connected to My Health record, we've got a tremendous amount of dispense records going up, and that can take place automatically as well. In WA, goals of care documents that are sort of similar to advanced care planning documents, they go up automatically in WA. And these reports generate automatically based on what information is in the My Health record, the overviews. So that's the Medicare overview, diagnostic imaging overview, pathology, and medicines information. In terms of what manually goes up, these highlighted areas are what manually goes up. Most of the patient entered information, that's all manually entered by the patient. Personal health summary is their medicines and allergies and adverse reactions to medicines that they are aware of. They can enter those in. Emergency contacts, advanced care planning documents. Only the patient currently can enter in there or upload their advanced care planning document. Organ donor registration status requires updating Medicare online. GP shared health summaries require knowing how to upload a shared health summary and doing that, or event summaries. So they are manually updated. It's not a huge number of clicks to do it, but it does require having the correct information in there to upload. So there are manual elements around that, and data quality to supply you with good shared health summaries and event summaries is something we'll touch on next. Pharmacies can upload pharmacist shared medicines list, which is a slow rollout at the moment, but it is increasing, where pharmacists can upload what's in a patient's Webster pack, for example, now, and upload that, but that is a manual process. Specialist letters are also something that can be uploaded similar to a shared health summary, and e-referrals that are done currently in Medical Director can also be sent and uploaded to My Health record. So there's a bit of a difference in terms of expectation that we'll find these manually uploaded things versus the auto uploaded things. So in terms of, next we'll talk a bit about data quality. So in general practice, we have the quality incentive payment, the quality incentive PIP, and the eHealth incentive, which includes data quality as requirement 3. Each complements the other. Generally, those practices that clean up their data use My Health record the most. as it assists with uploading and engages the practice in My Health Record information. Cleaning up data and uploading to My Health Record contributes to both PIP incentives. So for example, a quality measure could be to cleanse data, upload shared health summary for every diabetic health assessment or diabetic patient. Good clinical information and clinical judgment at the point of care is the basis of good quality nursing. It's the key reason why we make clinical information available to more clinical eyes than just our own. Clinical records are no longer just evidence of care. They are an opportunity for future clinicians to benefit from your assessments and your treatment. So what problems does data quality and complete records solve? So data quality is not unique to My Health Record. So for example, shared health summaries are already being faxed to hospitals before My Health Record. Previously, I worked with public health clinicians in New South Wales. I engaged the most senior specialists from one particular major teaching hospital in a conversation around My Health Record. They actually told me that they often receive faxed shared health summaries, which are exactly the same health summaries that are same information that's contained in a shared health summary that's uploaded to My Health Record. They receive these health summaries and find that the meds list, for example, is out of date. They end up with the copy of the document at the bedside and they're asking the patient what they're on anyway. So these doctors found that the quality of data in many health summaries was quite, not great. So how do we improve that? So documents uploaded to the My Health Record auto-populate with data from the patient's local medical record. So it's important that the data in your clinical information system is of the highest possible quality. And so I guess an example of what that looks like, as many of you might be aware, there is, for example, if I go into this example of best practice software, we go to upload, say, a shared health summary, and it connects to the My Health Record and populates a form with what's in the local system. So we're looking for what medicines are in our local system, what's active currently, what adverse reactions exist or allergies, medical history, and immunizations history. So these have pulled through, and is this information out of date? Is it up to date? How do we get to a point that we know when the RN uploads, everyone knows that it's up to date and accurate? So in effect, it's really up to our local processes, local ownership on ensuring that we have correct and up-to-date data. So we have some resources and information to support thinking around this. On the My Health Record website, you can search in the search field for pretty much any questions you might ever have about My Health Record, and it includes data quality. It says, references the RACGP resources, which have really good data quality resources, because after all, it is a responsibility of general practice to ensure that the information is ready to share when the patient requires it. The data quality health records have 7 attributes: completeness, consistency, legibility, accuracy, relevance, accessibility, and timeliness. So the following points outline the important relationship between data quality and your organization and effective use of digital health: accurate and up-to-date information, correct individual health identifier is recorded in the system. So that means, do we have the correct name, gender, date of birth, Medicare card number, and DVA card number? There's some tips for maintaining quality health records, so allocating time in busy periods, allocate a dedicated resource with medical knowledge, verify demographic information, etc. And there's a useful fact sheet that we have also developed. So these are the key fields that populate into a shared health summary or into an event summary. So for example, some practices would review these areas, say, focus on demographics for a month, or focus on making sure our meds list are active and up to date for a month, etc. So having processes in place to support improving accurate data helps. Previously, one respondent said, because you're putting your name as an author when uploading as a nurse, some nurses are not comfortable with adding the past history and allergies, as doctors do not like changing things in patient notes. So absolutely. So what some other people say that they do is that they might ask the patient, what are your what is your meds list? What are the medicines that you're taking now? You know, information about past history, allergies could go into the clinical notes rather than into the fixed fields. A message, you know, a previous respondent to a previous webinar on our community of practice webinars said that they send a message to the GP to complete or add missing data. And it's these fields, and having these fields up to date in your software is the key, is all it really takes to create good shared health summaries that, you know, regardless of if you're uploading or even faxing, having this up to date is essential, but we encourage you to upload it to My Health Record so that we can generate the benefits of moving away from dependence on fax. So some other people give other tips like, you know, considering the whole practice to review aspects of the record, clean up the data in chunks like we mentioned, pick certain cohorts of patients. So for example, health checks, families, people going traveling, you know, people that might be from the south to the north of your state. People are still traveling within states during COVID. So there is still an element of travel taking place. I'd be interested to hear from you on what tips or tips on data quality or your experience of keeping data up to date has been for your organization. So please do pop that into the question and answer box for us. So a little on resources. So we've got the fact sheet there. We've also got the on-demand training website. So you don't have to utilize your own software or test patient. You can utilize My Health Record on-demand training, which is accessed by you can go to Google, and if you type in on-demand My Health Record, and click on on-demand training for the Australian Digital Health Agency, scroll down, you've got the username, which automatically populates, but you've got the password here for Train Me. Copy that password, go to on-demand training and enter in the password Train Me. I've already gone in and that's why it sent me through. We've got best practice, Communicare, medical director. There's also a consumer portal. So what does it look like for the patient to view their own My Health Record, as well as Genie, pharmacy software, Fred, Communicare, and ZMed. So once you've put all that effort into improving your data for sharing, why don't you consider increasing your patient awareness that you're using My Health Record in the practice? So there are some resources that we have for that. So for example, we have a facility called Print on Demand, which is a website that's been shared quite widely as part of the electronic prescriptions rollout, but nevertheless, it's basically digitalhealth.immij.com with the username GP and the password digital health. And in there's resources for not only My Health Record, but electronic prescriptions as well. We click on Order Now. There's My Health Record materials, including brochures, displays for counters, etc., fact sheets, as well as if you're, particularly if you're in Victoria, there's electronic prescriptions, communications resources as well. But also we do have brochures and information sheets available that can be printed off from the My Health Record website as well. We do have a piece of feedback. So Our clinic, so I'll just go to questions. So if you do have any questions, please type them in now. If you have any feedback, we'd certainly welcome that. So we've got some feedback. Our clinic makes checking data quality for my health record a standard step in any GP management plan or health assessment. That's fantastic. Only pitfall with this is that we do leave or rely on the GP to follow up with checking the meds list is accurate and then uploading. More often than not, this does not get followed up and uploaded fully once the patient leaves the nurse's room. So yeah, understood. I guess that's, yeah, I guess that really echoes the idea that it's a challenge that we all face ongoingly. So the more, you know, like as maintaining that focus on data quality means that we can get maximum benefits out of systems like the My Health Record, because having that data ready to go means that it's quicker to upload and easier to get information in there available wherever the patient might present to. I might invite further questions or feedback from the audience, but we've reached the conclusion of our key element of content, just to say that there is a My Health Record website and helpline. The helpline is staffed 24/7. So it's a fantastic resource if you do get stuck with anything with My Health Record. We also have an Australian Digital Health Agency help centre and helpline. If you're talking to people that you refer to, allied health specialists, etc., and if they have not engaged with My Health Record, please do send them to the My Health Record website or to the Australian Digital Health Agency help centre to engage with the My Health Record program. Still taking questions or feedback if anyone's got it. Yes, go ahead.
We do have some feedback. So
yep.
When doing health assessments as a nurse, they ask the patient to bring on all the medications they take, including over-the-counter supplements, etc.
Great, excellent, good. Thank you for that, Megan. Can patients upload their meds list? Yes, they can. So one of the areas of manual entry is the personal health summary. And that's a place where the patient can type in their medicines, the allergies or adverse reactions to medicines that they've had. So that's a place that they type that in, and it pulls through to the medicines information view. So medicines that the patient enters in appears in the medicines information view. What that looks like is when we're in best practice, is we go into view the My Health Record. And we've got the medicines view. When there's a patient information that's entered, we see patient entered information. So you can tell which information the patient's entered in and which has been shared by, say, another GP in a shared health summary or a hospital discharge summary. So that's how we can access that. Important to note while we're in here is how to access the Medicare overview, which has a lot of automated information in it. We have to select to ensure that we're not excluding Medicare documents, and then update based on that, and that will pull through the Medicare overview. That's a very key document to be aware of, is the Medicare overview, and that pulls through the Australian Immunisations Register, as well as the PBS and the claims history. Another question, did you say patients can only upload their advanced care plan? Correct. So the patient can enter they can complete an advanced care plan and put it into a PDF. So the My Health Record system accepts or takes uploads of advanced care planning documents that are put into a PDF format. That could look like a general practice printing as PDF, emailing it to the patient, or giving it electronically to the patient to upload into their My Health Record. things have changed over the last couple of years where in WA, the Goals of Care document is a relation of the advanced care planning process. Goals of Care in Western Australia automatically goes up to My Health Record when it's completed in the system over there. And since then, the My Health Record capability to have software providers enhance their functionality to allow for advanced care planning documents to be uploaded by providers has been, so the agency have tweaked our side of it, but the software providers have not as yet built the functionality for advanced care planning documents to be uploaded from general practice. So if you'd like to see that sort of functionality in general practice software, please contact your software provider, best practice, medical director, Genie, etc. Give them feedback. What do you want to see? That they do listen to their customers, and that's how they prioritize what they'll do next with their software. How do specialists upload their letters? Similar to the way
Sorry,
that,
Kerry.
yes,
Just quickly, I'm going to be putting up a poll in regards
yes,
to the webinar.
yep,
If everyone who can see that would be able to answer that, and then Kerry will be able to keep answering questions.
okay, good. So this is our evaluation. Certainly welcome your feedback. We do take your feedback extremely seriously, and we do improve our education based on your feedback. You will receive an evaluation form via email as well. This is just a quick one while we're in the webinar, but all feedback we gain from you to APNA, but also to the agency, is extremely highly valued, and we do adjust our education based on feedback. So while you're completing that, specialist letters upload is similar to the shared health summary upload or the event summary upload. So there is, in a lot of software, there's, or certainly in some software, there's specialist letter functionality, and it behaves exactly like a shared health summary or an event summary upload. A bit more feedback was someone finds the nursing staff want to upload the current progress notes from that day encounter of care, but in only uploading an event summary does that count, but it doesn't count towards the total number for the PIP. So it's only shared health summaries that can count towards the PIP. So often, if we haven't got or had the time an acute care appointment to review their other summary info, it makes it hard to just upload the single contact visit notes, which can be just as important or relevant. Yep. So again, certainly recommend feeding this sort of information back to your software provider to give them ideas on how to improve their software. We've reached the conclusion of today's webinar. I just close with some final notes. So APNA have recently released new online learning. So My Health Record, taking your patient care to the next level. So if you've got colleagues or yourself interested in further learning or quite comprehensive learning about My Health Record, please do access these fantastic new online resources. And also, please encourage others to join the community of practice for My Health Record, to share learnings within an online communication platform, access to experienced APNA nurse moderators, and access to myself, Nikki, and our colleagues at the Australian Digital Health Agency. So thank you all for joining us. This webinar recording will be available on the APNA Communities of Practice website. We hope you'll join us for the next Nurse Digest session on that's coming up, and that will be how do you use My Health Record in practice. Stay well and see you next time. Thank you all.